Hello, I'm Dr. Glenn Graham, Deputy National Director for Neurology, Executive Champion of the National Telestroke Program, and stroke neurologist. This scenario is our best effort to illustrate acute stroke management from presentation to disposition. Here we illustrate a walk-in stroke, since many veterans present directly to their local VA with acute stroke symptoms instead of calling 911. Remember, time is brain. 1.9 million neurons die every minute that treatment is delayed, so reducing time to treatment is imperative. The teamwork between nurses, doctors, technicians, and the virtual telestroke neurologist is critical for minimizing time to treatment so that our veterans have the best chance of recovery. We'll show processes designed to save time, so please watch, learn, and enjoy.
Ma'am, help my husband. We were out walking and he fell down and he's not moving his left side. I'm really worried about him.
Just a moment. Sue, I have a patient with possible stroke symptoms out here.
Okay, ma'am, so what happened? We were just out walking and he was talking and he was fine and then he fell down and his left side doesn't seem to be working.
Okay, what time did this happen?
About 30 minutes ago?
So it's 9:30 now, about 9 o'clock?
Yeah.
Come on back with me to the emergency department.
Sir? No, you're not fine.
Hey guys, I have a suspected stroke patient here, witnessed this morning at 9 a.m. with left-sided weakness. His name is Jones, 4328. I need help back here.
Got it, Sue. Thank you. Julie, you have room 2, don't you?
I got him.
Anybody else available to help?
I can help. I'll grab the glucometer and meet Julie in the room.
Great. Thank you, May. Dr. Steele, did you hear we have a patient going to room 2, left-sided weakness, rule out stroke?
Got it. I'll be right in.
Perfect. I'm going to go get the telestroke stand and meet you in the room.
Mr. Jones, this is your nurse May and Julie.
Hi.
May and Julie. Mr. Jones had sudden onset left-sided weakness this morning at 9 a.m., witnessed by his wife. He's within the window for Altaplace. I'm going to go put in the stroke protocol orders, activate the stroke code, and call the telestroke consultant.
Okay.
Just sit still, sir. I'm gonna...
Mr. Jones has been registered. There's his wristband. Great. Thank you.
Yes, hi Julia. This is Sue in the ED. We have a stroke code in bed 2. Okay, thank you.
Hello, this is Dr. Warren.
Yes, hi, Dr. Warren. This is Sue in the Springfield, Ohio VA. We have a stroke patient here in our emergency department. His last name is Jones. His last 4 are 4328. He has left-sided weakness that started about 9 a.m. this morning. It's now 9:35 our time. We're on Eastern time. My callback number is 222-555-8989.
Okay, I'll be on the iPad in just a few minutes. Thank you so much.
Attention, stroke code, ED, room 2. Stroke code, ED, room 2.
Got a stroke coming.
Okay. Well, I'm going to call the radiologist and give him a heads up.
All right, let me set up the table.
Okay, team. I have the stroke app for documentation. What do we've got, Julie, for vital signs?
His blood pressure is 178/94. He's got a heart rate of 90. He's 98% on room air. Respiration rate of 12, and he's also afebrile at 98. I placed 2 18-gauge IVs. He's got 1 in the left AC, 1 in the right hand, and I'm finishing up drawing labs right now.
Perfect. May, were you able to get a glucose?
Yes, it's 132.
Okay, glucose 132. How about a weight? Did we zero the stretcher before we got the patient on the stretcher?
Yeah, he is 87.3 kilograms.
87.3 kilograms. Great.
So for your documentation, Karen, I called the stroke code at 9:33 and I called the telestroke doctor at 9:35.
Wonderful. So we activated the stroke at 9:33 and the teleneurologist was called at 9:35.
Yes, I need to get back to triage.
Okay, thanks for everything, Susan. Appreciate it.
Hi, I'm from Lab.
Oh, great. Yes, we have stroke patient Jones, 4328. These are priority staff.
Correct. I'll take it right to the lab.
Thank you so much.
Hi, are you Miss Jones?
Yes.
Hi, I'm Dr. Steele. I'm one of the ER doctors.
Okay.
Is this your husband?
Yes, sir.
Mr. Jones, what's going on this morning?
Well, I fell down this morning. Now I'm fine.
Feel fine right now? What do you recall happening?
We were out for our morning walk and we're just walking along talking, and all of a sudden he fell over, and when I tried to help him up, he couldn't move his left side.
Okay. It's really important with this type of case to know exactly when this started. What time was it when you found him, or when he fell over?
It was about 9 o'clock.
So this would be 40 minutes ago, is that correct?
Yes, sir.
Okay. I'm going to take a quick look at you, okay? Can you look right at my finger? Look all the way over to your right side. Back over here, all the way to your left side. Mr. Jones, give me a big smile and show me your teeth. Okay. Hold this arm up. Give me a good strong squeeze. Good. Try to hold your left arm up. Okay. Lift your right leg up. All right, that's good. Hold your left leg up all the way. Let me lift it up for you. Try to keep it up for me.
Dr. Steele,
Okay.
CT called. They're ready for the patient.
Great. Let's get him ready to move. Given how weak he is on that side, I'm concerned that he might be having a large right MCA stroke, and he is within the time window that we could treat him with IV TPA or an endovascular treatment, okay? So let's get him down to CT as quickly as we can.
A stroke?
Yes, ma'am. So we're concerned that he might be having a stroke now based on how he's looking. We're going to take him down and get a CAT scan, which is a type of x-ray, to look to see if he might be having a stroke, okay?
Okay.
While we take him down, we've actually started consulting with one of our national telestroke specialists. They're a stroke specialist with the VA.
Okay.
And they're going to be calling in on this monitor over
Okay.
here and ask you some questions, okay?
Okay.
We're going to take him down right now, but I want you to stay here and answer any questions that they have while we
Okay.
get the scan done, okay?
Okay, sir.
Okay.
All right, thank you.
I'm going to step out and go start looking at his medical
All right.
records.
You're going to take good care of you, honey. I love you.
You can have just a seat right here. They'll be calling
Okay.
in shortly, and then we'll be
Okay.
able to
All right.
continue. Everything will, we'll take good care of
Okay.
him. That's the teleneurologist. I'll be right with you.
Hi, my name is Dr. Warren. I'm a stroke neurologist at the Central City VA. How can I help you?
Hi, my name is Karen. I'm the ER nurse here. I also have Mrs. Jones here. Mrs. Jones is the patient's wife.
I'm Mrs. Jones.
Mr. Jones is in CAT scan right now. I'm going to run and go get the doctor. I'll be right back.
Thank you, Karen. Hi, Mrs. Jones. I'm Dr. Warren. How are you today?
I'm doing.
Okay. What's going on?
My husband fell down and now his left side's not working.
Okay. When did that happen?
About 9 o'clock?
Okay, and he's perfectly normal right before?
Oh, yes, ma'am. Perfectly fine.
Okay. It looks like the ER doctor is right there.
Yes,
I'm going to
yes.
ask him a few questions, but don't go far.
Hi, I'm Dr. Steele. I'm one of the ER doctors. You've got Mrs. Jones here, and he came in and she says that he fell about 9 o'clock. He's a 58-year-old male with hypertension and diabetes. He's not on any antithrombotics. When I examined him, he appeared to have complete left hemiplegia, and it looked like to me that he was neglecting on his left side. So because of all that, I was concerned that he might be having a large right MCA stroke, so we sent him to CAT scan, but I also wanted to get a CT angiogram at the same time to look for a large vessel occlusion.
Okay. Great catch. You're right. It does sound like a right MCA vessel occlusion. We should start the transfer process for any endovascular therapy right away.
Okay, yes. If you think it might be a transfer, I need to get going on that right now because that can be a time-consuming process. So I'm going to step out and go work on that while you talk to Mrs. Jones.
Okay, great. Thank you so much, Dr. Steele. Hi, Mrs. Jones. So I'm going to ask you a few more questions, okay?
Okay.
Okay, so before 9 a.m. he was perfectly normal and then had a fall and you noticed weakness and brought him in.
Yes, ma'am.
Okay. And then how did you get him here?
We came by car. He wouldn't go in the ambulance.
Okay. And you guys did the exact right thing. It sounds like this could be a stroke. We need to figure out if this is a type of stroke where there's not enough blood getting to the brain because of a clot or from another reason. So I'm going to ask you a few questions, okay?
Okay.
Okay. Does he have, does he take any blood thinners at all?
No, ma'am.
No, ma'am. Okay. Anything like Coumadin or Rivaroxaban or Apixaban or
No, ma'am.
Digabatran?
No, ma'am.
Any aspirin or Plavix?
No, ma'am.
Okay, when did he have his last surgery?
Oh, it's been years.
Years, okay. Any history of a stroke or a head trauma in the past 3 months?
No,
or
ma'am.
heart attack?
No, ma'am.
Okay. How about a history of a brain aneurysm or brain tumor?
No, ma'am.
Okay. Any bleeding from any part of his body, from his bottom or his mouth or in his urine?
No.
Okay. So it doesn't sound like there's any contraindications for giving this clot busting medication.
Okay.
Okay. So we need to wait for the head CT so we can figure out if we can give it or not. This may be a stroke from a clot or maybe a bleedy type stroke. So as soon as we know that, we will let you know. Okay.
Will that take very long?
I don't think so. It sounds like everything's going according to plan. So I'm
Okay.
going to talk with the nurse, Karen, right beside you, and then Dr. Steele when he comes back in the room, okay?
Okay.
Okay. Hi, Karen.
Hi there.
So do we have a weight for Mr. Jones?
We do. 192 pounds. I think they
Okay.
came to like 87.3 kilograms.
Okay. It looks like the patient is coming back into the room.
I think he may be an Alteplase candidate. We should get the Alteplase to the bedside and start.
Reconstituting.
Okay.
And so we can calculate the dose.
Okay, I do have the Alteplase here in the stroke kit.
Oh, great.
I do have a quick question. So it's okay to reconstitute the medication before we have
Yeah.
the CAT scan results?
Absolutely. They have a Alteplase return program, and so your VA would be reimbursed for any if it was not used. And so
Okay,
don't worry
great.
about that because he's definitely within the time window.
I'm going to move your iPad so you'll be able
Okay.
to see the patient better. So you let me know when to stop, okay?
Thank you so much.
How does that look for you?
A little more over to his right. That's good.
Okay, I'll step aside over here.
Hi, Mr. Jones. My name is Dr. Warren. I'm a stroke specialist with the VA National Telestroke Program, and I'm here to help today. Are you able to see and hear me?
Is it okay if we use this doctor to talk to you on this remote monitor?
Yeah.
Okay, good.
Okay. And I see Dr. Steele there. Who else do we have in the room?
Hi, Dr. Warren. I've got May. She's one of our nurses.
Hi, May.
And this is Julie. She's the primary nurse for Mr. Jones.
Hi, Dr.
Hello,
Warren.
Julie. And then now, where are we with the NIH stroke scale?
So I just got that he was completely weak on his left side, but Julie's been doing the other parts of the stroke scale, so she can fill you in on that.
Okay, perfect.
We got 0s for item 1 in gaze, 2 for the
Okay.
left face droop, 4s for the left arm and leg, 2 for the total loss of sensation on the left face, arm, and leg. He's completely unaware of being touched.
Okay. All right, Mr. Jones. We're gonna check a few things now, okay?
Okay, good. Can you hold up your right arm for me? And you're going to keep it there. Okay, hold it up a little bit higher. Perfect. We're going to count to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, good job. Now, with your left arm, you can put that arm down, sir. Put your arm down. Good job. And now lift up your left arm. Okay. Dr. Steele, can you lift up his left arm for me?
It feels very limp.
Okay. Can we lift it up one more time and put it in front of his face? Mr. Jones, whose arm is that?
This is your
Okay,
arm?
perfect. Okay, team. Mr. and Mrs. Jones.
I see an obvious facial droop. We have flaccid left side. I see profound neglect. I think we should do a quick timeout.
Okay? Can everybody hear me?
Yes.
Yes.
Okay, perfect. Mr. Jones was in his usual state of health.
And was perfectly normal until 9 a.m. today when he abruptly fell to the ground with left-sided flaccid paralysis and neglect, or ignoring things on his left side. Is that correct?
Yes.
Excuse me, Dr. Steele, radiology's on the line for you.
Okay, great. I'm going to step away for 1 second and get this radiology report.
Okay, I will continue. So I have that the patient's glucose is 132. His blood pressure is less than 185 systolic and 110 diastolic. Is that correct?
That is correct.
Yes.
Okay. So as soon as we hear from the CAT scan, I think we can decide if we're going to give the Alteplase or not.
Okay, so I just talked with our radiologist, and they said the CAT scan looks fine. They did not see any bleeding.
Perfect. Okay. Mr. Jones, your head CT does not show any bleeding, which makes me think that this is a clotting type of stroke. Based on my conversation with you and your wife, it doesn't sound like you have any bleeding problems, any bleeding from anywhere in your body, any recent surgeries, medical procedures, cancers, recent strokes or heart attacks, or being on blood thinners, anything that would keep us from giving you this medicine. Is that correct?
But I'm fine.
Okay.
I'm fine.
I understand, Mr. Jones. Mrs. Jones, is that correct?
Yes, ma'am. Everything you said was right.
Mr. Jones, we believe you would benefit from a medicine called Alteplase.
It can reverse stroke symptoms. It's a very strong clot buster, and we believe that it may dissolve the clot that's causing your stroke.
We give it 1 time by IV, and it makes your blood very thin for up to a day. There is a small risk of bleeding, which
Can occur anywhere in the body, but it's most dangerous when it occurs in the head. This is my recommendation right now. Would you be willing to take the small but serious risk of bleeding in return for the larger chance of having your symptoms improve? Okay. Mrs. Jones, I don't think your husband is able to make this decision because he's not recognizing his stroke symptoms. I don't think he's aware of his deficits, but if he was, would he be the type of person who'd be willing to take the small risk of bleeding for the larger chance that his symptoms would improve?
Yes, ma'am.
And so I think we should proceed with the drug called Alteplase to treat your stroke. Is everybody in agreement?
Yes, I am.
Okay, so we'll need Mrs. Jones to sign the consent form for her husband.
Mrs. Jones, if you'll come with me,
Okay.
I'll have you sign the consent here at the desk.
Okay, Karen, what is your Alteplase dosing calculation?
I have his weight as 192 pounds, which comes to 87.3 kilograms. The
Yes.
dose is 0.9 milligrams per kilograms, so I calculated a total dose of 78.6 milligrams, which we can just round up to 79 milligrams. The 10% bolus would be 7.9 milligrams given over 1 minute. The remaining dose of 70.7 milligrams would infuse over 1 hour with a waste of 21 milligrams.
Perfect. That's exactly what I got as well. Are we all in agreement?
Dr. Steele?
Yes, that's what I calculated as well.
Yes.
Okay, perfect. So Karen and Julie, can you prepare the Alteplase?
Absolutely.
Yep, got it.
And then Dr. Steele, will you help me finish the NIH stroke scale?
Sure.
Okay, great. Okay, now Mr. Jones, I want you to look at Dr. Steele's nose, and he's going to check a few things, okay?
Look right here at my nose. Can you see my fingers wiggling? How about up here? Okay, good. So no problems on the right side. Keep looking at my nose. Do you see my fingers over here? You see them there? How about up here? Okay. So Dr. Warren, to me it seems that he's got a visual field cut involving the left visual fields.
Okay, I'm going to give him a 2 for section 3.
Okay.
All right? Let's go ahead and do facial palsy. Mr. Jones, can you show me your teeth? Okay. And can you raise your eyebrows? Like you're surprised. Okay, perfect. I'm going to give him a 2 for number 4. We already did the arms, so we're not going to do those now. He got a 4 for his left arm and a 0 for his right arm. Let's do his leg. Mr. Jones, lift up your right leg for me. We're going to keep it up there and count to 5. Lift it up all the way. 5, 4, 3, 2, 1. Okay, great. Put that down. Put down your right leg. Okay, let's lift up that left leg. Lift it up. Okay, Dr. Steele, could you help him lift up his leg?
Sure. Mr. Jones, try to keep your leg up off the bed. Don't let it fall.
Okay. Did you see any movement there, Dr. Steele?
It looks to me that he's got some trace movement in that leg, but he's certainly not anti-gravity in that leg.
Okay, we're going to give him a 3 for his left leg and a 0 for his right leg. All right, let's do finger, nose, finger. We're going to check for ataxia. Okay, so Mr. Jones, you're going to touch your nose. Can you touch your nose? And you're gonna touch Dr. Steele's finger. Touch his finger. Now touch your nose. Now touch his finger. Okay, great. That looks perfect. Let's check heel to shin. Mr. Jones, can you take your right leg and touch your knee? Dr. Steele may have to help you.
Okay, I'm going to demonstrate for you. I want you to try to do this for me. I want you to take your heel here, put it on your knee, and go straight down your shin like this. Can you make a straight line for me?
Just do that. Just do that for me. All the way down, all the way up. I don't see any ataxia there, do you?
Yeah, he's not on his knee, but it looks like a pretty straight line that he's making.
Okay, perfect. So I'm going to give him a 0. We did sensory earlier. I'm going to give him a 2 since he couldn't feel anything on that left side. Okay, now we're going to check aphasia. Could you get the NIH stroke scales cards from my telestroke stand? They should be in the basket.
Okay, I have them right here.
Perfect. Let's start with the main picture.
Okay, I'll start with this picture of the scene.
Okay.
Mr. Jones, can you describe to me what you see in this image?
Yeah, there's a lady standing, washing dishes, water flowing, cup.
Okay, great. Do you see anything else in this picture? No? Okay. So he described everything on the right side of the image, but nothing on the left. I'm going to show him now these other images and have them name them, okay?
All right.
Tell me what you see here.
Glove, chair, feather.
Okay. He accurately named the pictures only on the right-hand side of the image.
All right. Let's do some of the short sentences or short words.
Tell me what you can read from these sentences.
Earth, from work, in the dining room, speak on radio.
Okay, I'll show him this picture here. I'm going to hold it over here to see if you can see a little bit better. Can you name or read these sentences here?
Mama, tip-top, 50-50, thanks, Huckleberry, baseball player.
Good.
All right. Mrs. Jones, it sounds to me like your husband's speech is a little slurred, but I can still understand him. Would you agree with that?
Yes, ma'am.
Okay. But I can still understand him, so I'm going to give him a 1 for number 10. And for number 11, we're going to give him a 2. And that gives me an NIH stroke scale of 16.
Okay.
Okay.
I think that's what I was calculating too as we went along.
Do we have the Alteplase ready?
Bolus is ready.
Okay, perfect. So
what's his blood pressure?
So it's currently 164/90, and that was cycled 2 minutes ago.
Okay, perfect. So I don't have any labs reported out yet, but Mr. Jones doesn't have a history of low platelets, and he's not on anticoagulants, so I don't think we need to wait.
So let's go ahead and give the bolus.
I'm going to get the infusion ready.
Okay, and I have the infusion as 70.7 milligrams to be given over 1 hour.
That's correct, 70.7 milligrams. I'll get this ready for when her bolus is complete.
Okay.
Bolus 7.9 milligrams going in at 10:08.
Okay, 10:08.
Dr. Warren, Dr. Steele again. I just got off the phone with our radiologist. He called back because he just read the CT angiogram that we did, and he confirmed our suspicion and saw a thrombus or a clot in the proximal portion of his right middle cerebral artery. So when I got that call, I went ahead and talked with the interventionalist at our referral center, City General, and they said that they'd be willing to accept him and transfer for possible thrombectomy.
Okay, great. And we'll call EMS and get that moving.
Yeah, I'm going to go double check on that right now.
Okay. And Mr. and Mrs. Jones? Mrs. Jones, are you still there?
Yes, ma'am, I'm right here.
Okay. I think, my part is done here. We've gone ahead. We've given the Alteplase. Your husband's gotten the FDA-approved therapy for stroke. We're working on transfer for possible clot retrieval. I wanted to check to see if either of you had any other questions.
No, I think we're good right now.
Okay, good. It was a pleasure to help you out today. I think that your VA has this under control.
Thank you so much.
Okay, perfect.
I'm going to move the stand out of the way a little bit. Our EMS colleagues have just arrived, okay?
Okay, great. Good
And
job,
I've got
everybody.
I've got the infusion, 70.7 milligrams for 10:09.
Okay, and then we have the 50 cc bag to chase that with?
Yes, we do.
Okay, perfect. Thank you, guys. Goodbye.
You have now seen an example of a successful code stroke. It was efficient and smooth, using best practice strategies such as rapid triage, alteplase readily available to the bedside, and early recognition of the need for endovascular therapy. Since every VA is unique, some variability in processes is expected. The VA endorses Nurse First Look and advanced triage protocols, which can be coupled with a direct-to-CT scanner process. These are just a few of the American Heart Association's best practice strategies for acute stroke. Thanks for watching. We look forward to seeing how you incorporate the strategies seen here into your facility's acute stroke protocols.